Hi, this is Jeff Weinberg with Caregiver Champion, and it's my pleasure to introduce a expert and a pioneer in the field of healthcare patient advocacy. I had the pleasure of meeting Anne. It's been a number of years ago already, at a conference that I was a speaker at, and she was one of the people who was heading up the conference. And fortunately, I've been able to stay in contact with her for the many years that I've been a patient advocate. And she's always been helpful to me, and her passion and her commitment is to really to help as many people as possible. So without further ado, Anne Llewellyn.
Thanks, Jeff. And I think that conference was in 2010, 2009 or 2010. And so it's been quite a while. It's been, and we have kept in touch. It's been nice through Facebook and just every once I see you on LinkedIn. So you're definitely out there. And you're someone that I've always looked up to too, for the work that you do, especially for the elderly in nursing homes, and really trying to make sure that the patient, the family, has a voice in what's happening to them. So thank you for your work.
Well, thank you for your kind words. And if we met at 2010, we must have, both of us must have been about 25. Right?
Oh, yes, definitely.
Well, that's wonderful. I love what you both said about one another. That's why we're here doing these Q&As with like-minded people to share information that's helpful to people. So we're really happy to have you today, Anne. My name is Rachel, and I'm the marketing director for Caregiver Champion. And we're going to start off. We'd love to just learn a little bit more about your background, Anne.
Okay, great. Well, I'm a nurse by background, by training. I've been a nurse. I've been a nurse longer than Jeff's been. I'm from Philadelphia.
Okay.
So we're both from the great state of Pennsylvania. And I've been a nurse. I worked critical care, worked in the emergency room, and then intensive care, and never really saw what happened to people after they left those areas. You know, in the ER, we would send them up to the ICU or to the operating room, and then you would really not hear from them again. Or when I worked in ICU, either they went home or unfortunately sometimes passed away. Never really saw what happened after. And when I moved to Florida in 1988, I got into what's called case management. And I'm a nurse, so I was a nurse case manager. And I worked with the same type of patients, but as a case manager. So I did see what happened to people when they came out. Like for people that had amputations, we would get involved with them once they were out of the hospital, maybe gotten into a rehab program. And then I got to see how well people can do, how resilient people are, especially if they can have the resources they need to take care of themselves. So like an amputee who would get a prosthetic, who could then go back to work, or who could take care of their family as the mother. So that was a turning point. And in 2014, and this is after I met Jeff, and I was with, I had left case management. I was in an education company for a while. Then I went to work for a company called Llewellyn Health. And then we got into what's called patient advocacy. We started the Professional Patient Advocate Institute in 2010. And that's when we were doing the webinar.
That was the conference I was at.
Yeah, that was the first conference. So that really opened my eyes to a whole nother area that helps people, patients, families, you know, navigate the healthcare system. It's very complex. Even if you're, you know, just in it, until you're sick, you don't realize how complicated it is, or you have someone who is sick. Right. And that really was brought back to me in 2014. I was diagnosed with a brain tumor. Wow. And I became the patient.
Wow.
And I was very lucky that I had two people who were advocates for me, who I was in a small hospital, because when I went to the emergency room, I had a little car accident. like what they call a fender bender. And I couldn't drive the car, so I had to call my husband to pick me up. He came and he said I didn't look right. I still don't know what he meant by that. I didn't look right. But he said we have to go to the hospital. So we went to the ER, small hospital in our neighborhood, and they took a CAT scan and it showed a brain tumor. So I was immediately thrust into that patient role. And the doctor at this hospital, they called a neurosurgeon in. They were going to open my brain, open my head and get a biopsy. And these two friends, Kathy Bowers, Jeff, I think you know Kathy, and another friend, Marilyn Van Houten, they came to the hospital while the doctor was going to give me and my husband the overview of what he was going to have to do. And when he told us what he was going to do, he said, this is not the place to have brain surgery. It's a good hospital, but it's not, it wasn't like, a center of a specialty hospital, right? So they got me down to the University of Miami. And I did have the brain biopsy, and once they figured out what the tumor was, the type, they referred me to a specialist who actually specialized in that tumor. I think if I would have stayed in the original hospital, I probably wouldn't be here right now, because I don't know this, it's only my assumption, but I really do credit with going to the University of Miami with saving my life, because I had a doctor who specialized in the type of tumor I had and treated me with state-of-the-art, it was not experimental, but it was new therapies that really did eradicate the brain tumor.
Wow.
So that gave me another turning point in my career to really focus on patient advocacy, because that hospital was doing what they had to do, but they would not tell me, you shouldn't be in this hospital. Maybe if they didn't have a neurosurgeon or do brain surgery, they would have told me, but they did. So I would have stayed there and had treatment. They had oncology, but so I realized that we need somebody independent of the healthcare system to help us know what the resources are, know what the options are, objectively know what they are, and then help us make those decisions. Now, if I would have left the hospital and said, oh, I'm going to go to the University of Miami, I wouldn't have been able to get in there as easy as I did with somebody making a phone call, calling the head of neurosurgery, getting a doctor to accept me, and then going there. It would have been a lot of red tape. It would have been a lot. And my husband, who was my advocate because he's my husband, he didn't know how to do that.
Right.
He is not trained to do that. So these two people navigated the system. They knew how to work the system. And that is what I attribute to being here today. And the passion that I have, as Jeff said, for advocacy, because it's something that most people don't know about.
Right.
We believe in this system. We believe, and really, I don't think anybody at the first hospital was going to intentionally do anything to not help me. It's just the way the system is set up.
That's an amazing story, and what a brilliant example of how important patient advocacy is. You experiencing it.
The doctor that you saw there, though, recommend to go somewhere else?
No, and he was very upset that we were going someplace.
Oh, I thought, okay.
He said, I can handle this. This is what I do. I'm a neurosurgeon. And he wasn't happy. Now, he discharged me, and then I had to get readmitted down. He didn't transfer me. I didn't get a transfer. I got discharged.
Wow.
And then went to the University of Miami on my own. So yeah, he was not happy. He even asked, when he walked in the room that morning, I remember my two friends were there. We asked them to come. And he said, who are they? Why are they here? Are they attorneys? I guess because I had a car accident. They thought they were attorneys. And my husband explained who they were and that they were there to help him and me understand what was going to happen.
Mhm.
Okay, well, they can stay, but they can't take any notes. They can't write anything down.
Interesting.
So again, the system, and it's just how the system is really set up for the healthcare system, not for the people who use it.
Right.
And that's why we're involved. We as patient advocates are
Right.
involved, I believe.
That's
I have said this not in the same fashion, but if you work for a system, then you're loyal to that system because
Right.
that's where you're getting your paycheck.
mhm.
However, it may not be the best place for whatever it is that you need.
Right.
And it is really important to do what you did because I don't think enough people understand that.
Well, if I didn't have those two people who helped me, I would not have done it. My husband wouldn't have done it. We wouldn't even have thought of doing it. But they were there and they knew, I mean, they just, because of who they are, their experience, their expertise, their knowledge, and knowing other resources,
Right.
were able to suggest, because my husband could have said, no, we're going to stay here. It's close to our house. You know, I can get here in 5 minutes versus University of Miami is all the way in Miami. I'm in Fort Lauderdale.
Right.
We have to fight rush hour traffic. Do we really want to go there? Will the insurance cover it? All those things that come up with choices.
No.
And some people opt for, well, they can take care of me. This is a hospital, that they have doctors. This is what they were, he's a neurosurgeon. Why would we go anywhere else?
It's such a brilliant example. I want to tap into a little bit more specific on what it means to be a patient advocate. So if someone wanted to become a patient advocate, how would they do that? And what exactly does it mean to become a patient advocate? And then what are some of the requirements to become certified?
Yeah, well, many people get into advocacy for a lot of different reasons. You know, I'm a nurse, so I understand the healthcare system, so I can be an advocate for somebody to navigate the healthcare system. There's people who are in it because they understand business. They can read bills, they can read hospital bills, and they can understand that this bill doesn't match what you had, and they could question that. And they have the skills, negotiation skills, critical thinking skills to do that. There's some advocates. I met a woman, and I always tell this story at a conference that's similar to what Jeff was at. She was from Colorado. Her company was called Daughter in a Pinch. Daughter in a Pinch.
Interesting.
So you can imagine what she did. Now, she had no medical training. And she told me, I only have 5 clients at a time, and they pay her bills. And she said what she does, she takes people, she goes grocery shopping for people. She takes them to the hairdresser. She works mostly with an older clientele who many of their friends are gone. Their families might be in other parts of the country. They never wanted to leave Colorado. Everybody else and their families in other cities and states. So she doesn't really they don't have friends. She goes on vacations with them. She goes to the movies, goes to the opera. That people still want to do things, but they don't have anybody to do it with. So she fills that void.
That's really
That's what kind of an advocate is that? What kind of training do you need to do that? I think the biggest thing in advocacy is finding a niche, finding why you want to do something to help other people.
that's great.
And then that is an advocate. Now, there is some training, more and more. As Jeff said, we met at the conference. The Professional Patient Advocate Institute doesn't exist any longer, but that was our goal, was to have some type of a training where people who wanted to go into advocacy could learn basic facts, basic.
Is there a go-to like that anymore?
Yeah, there's other places like, you know, Trisha Torrey, we know her name, Trisha Torrey. She has the Alliance of Healthcare Professional Advocacy Advocates. And she has done so much for the industry to help train people to how to start a business. Most healthcare professionals or people who want to start a business don't know how to start a business.
No, they
So
don't.
what do you need? What do you need to do? Do you need a marketer? Do you need social media? How do you do that? So a lot of people think, well, I want to be an advocate, and they become an advocate. They say, I'm going to become an advocate. I start a business, but they don't know really what the steps are, and they fail. Only not fail because they can't do the work, but they can't run the business.
Right.
So there's Trisha's organization is for that. The National Association for Healthcare Advocacy, NAC, is the professional organization for advocates. We have education on clinical issues, on, like on brain tumor or traumatic brain injury or atraumatic brain injury, because they're different, and we have those programs to educate advocates so they understand conditions that they're going to run into if they're doing clinical. Or we could have a billing advocate talk about the healthcare insurance industry, how it's changing, and what to look for when you do review bills for your patients. So
Great.
education, there's some universities out there. Assumption College in New York has a patient advocacy, a master's program in patient advocacy. That's somebody who could major in business with a secondary major in healthcare advocacy and become an advocate. There's a lot of different advocates.
Yeah.
Someone who is in health policy is an advocate, and someone who does what Jeff does, what I do on this individual level. There's also hospital advocates, people who are in the hospital, who walk around, who go visit patients, and you're not happy with your room, you find the room's dirty, the doctor hasn't been in to see you, you don't know what's going on. So there are people who understand the system and can find out what the problem is, the patient's having a problem, and try to rectify it, because they know who to call. So there's a lot of different types of advocacy, and the Burrell Institute, which is a national organization, they have a subset of their membership who are advocates, hospital advocates. So there are different places, and I can give you links to all these.
Yeah, that would be great. We'll put the links in the comments so other people that are interested.
So if people are looking for their niche, their little area that they want to focus on. A lot of people come into advocacy because of personal experience.
Right.
They went through the system. They know it isn't. There was so many hurdles that they don't want other people to have to go through that again. And they may have a business background. They may, some people who are non-clinical start a company, and then they bring in a doctor to consult, or they bring in a nurse to consult, because they might not have the skills. I think that's one important thing, that we don't want to do things that we're not trained to do. We don't understand. We don't want to project ourselves as being more than we are. But there are so many people to help that you can consult with, that you can ask questions, that you can refer to. Absolutely. That help people be able to stay within, as they say, stay in your lane for what you know how to do, and do that well, and then bring in other people to help.
I think that's so important. I have been a healthcare administrator, and I know the system, and I know how it works, and I know the resources, and I know where to send people or help them get the proper help that they need. But as my practice has grown, I've found that there was a lot of stuff that I have now brought on to registered nurses, a concierge physician, a MS specialist, and a physical therapist, because they have expertise that I don't have, nor do I want to have. So
we all can't do everything. There's a whole team out there of people, and tapping into them. And the
It's
advocate kind of keeps everybody on track. We improve communication between the team. We find resources, as Jeff said. Somebody doesn't have something, we all have insurance, or hopefully have some type of an insurance policy, and it might not pay for something, but where can we get those community resources to meet that need, even though the policy doesn't cover it? Or negotiate a rate that an individual person can pay for,
Right.
even though they don't have coverage. So there's a lot to do. And you need somebody, again, who understands the system to be able to work it, but it can be worked
Absolutely.
in an ethical way,
So we're running out of time a little bit here. We got about 5 minutes, and we have a couple other questions we want to get to. So I'm going to speed it up here a little bit. Are there any upcoming conferences and resources that are helpful that you'd like to share? And we'll put the links in the comments.
Yeah. Well, there are going to be. We had a conference planned in October, which was going to be the second international conference on patient advocacy, and that's going to be virtual. So I can send you the link for that, and you can share that with your audience.
Great.
We would also like consumers to come. We really want to open the conference to people who are in advocacy, but also consumers who might be interested in learning about the practice. There are a lot of webinars. There's one very good webinar that's going on right now. It's titled Healthcare Summit, reflecting on COVID-19. We're all experiencing this right now. And this has been a 5-day summit. We're in day 3. Today's day 3, but I will send you the link. It's free.
Great.
And it's going to be available on demand. You'll be able to look at each day. And the professionals who have been interviewed, and it's an interview similar to this, have been very good with sharing some very good information about nutrition, wellness, how to increase your immune system, how to fight stress. We had a doctor on yesterday who talked about chronic back pain and some of the things that he did himself as a chronic pain sufferer to understand that. So I'll send you the link for that. But then there are some other nice webinars. I know Gray Zone is another advocacy organization that's done 2 webinars on hotspots with COVID. They've had 5 different speakers talk about different areas of the country and what they were doing to help fight COVID. So I can send you those resources so you can post them.
That'd be terrific, because our population would love to be connected with a lot of those resources.
Yeah, and a lot of them are for the advocates themselves or for the consumers, so they can benefit both.
That's great.
Yeah.
So speaking of COVID-19, what has been your experience with people that have been in isolation and nursing homes, and how has that affected?
Very hard. Very hard. I had a couple cases early on in maybe March. A lady called me from California. Her sister, twin sister, was in Miami. She had a stroke. And she couldn't get any information. She couldn't talk to her sister. She couldn't get there from California to see her sister. And all she wanted was for the nurse or somebody to put the phone on FaceTime so she could see her.
Yeah.
And that was early in the shutdown. And I think hospitals hadn't thought of that yet, the technology that we can use. So now, but that was one thing that I did. Improve communication, have one person be assigned to talk to the sister, because, again, we couldn't go in. I couldn't go down there, even though I was in the area, and see her. But to improve the communication is what all we needed to do. And the woman did fine. She recovered. She went to rehab, and she's doing a lot better. So a good ending. But yeah, COVID's been very tough, especially for the elderly. I'm working with another woman who's 94 that lives in an independent living facility. It's been in her apartment now since February, and has had some medical challenges, and it's been difficult. Again, I can't go in to the hospital. She's had to get admitted for chest pain. All I could do was call, and then to try to get the different people to understand who I was and why I was asking questions was hard. I wrote a blog post on it. I'll send you the link.
Yeah, definitely. I will put that link in the
People
comments.
really have a hard time understanding what is a patient advocate. That's why I
Yeah.
wanted you to come on, because
Yeah.
it's such
And
a,
even having a consent that the patient has allowed me to be involved in their care has not made the road easier. It's still like, why are you involved? We don't have you, so we need to learn, we need to be better prepared. Diane Savastino, another woman, has done some really good blog emails, weekly emails on being prepared, having an emergency kit that if somebody has to go in the hospital, that tells who your surrogate is, who your patient advocate is, what your advance directives say, and having that with your suitcase if you know you're going to be sick in the hospital. So you take it with you to the hospital so people know your wishes.
Absolutely.
These are some of the things that advocates do to help people prepare for the process.
Unfortunately, Zoom is about to kick us off. I keep getting these warnings. We have less than a minute. And so I want to make sure that we tell people, first of all, I want to say thank you so much for your time. This was such great information. And where can people find you? We'll put those links in the comments.
Yeah.
Let people know.
Nursesadvocate.com is my website, and I'll send you that link. So if anybody who has any questions, I'd be glad to answer. And then even just through you or Jeff, if you want to refer anybody to me, that would be fine.
Absolutely. Absolutely. This was such a great and important conversation. Everybody, this is Ann Llewellyn. Thank you so much for your time. My name is Rachel. I'm here with Jeff Weinberg, the president of Caregiver Champion. If you want to find out more about Jeff and what he does with patient advocacy, you can check out championcaregiveradvocate.com. And thanks everybody for listening. Thanks, Ann, so much.
You're welcome. Thank you.
this
Thanks,
was
Jeff.
super. I can't believe, I mean, I learned so much just